Hello everyone, I'm Satoki Shichijo from Department of Gastrointestinal Oncology in Osaka International Cancer Institute, Japan. On behalf of all co-authors, it is my great pleasure to discuss our paper entitled Safety and Feasibility of Intensive Endoscopic Interventions for Delayed Perforation After Colorectal Endoscopic Submucosal Dissection. Colorectal ESD is widely performed for large superficial colorectal tumors. However, it can lead to adverse events. Among them, delayed perforation is a hazardous adverse event, which may require emergency surgery. Thus, we focused on delayed perforations. We previously reported that about half of delayed perforation cases recovered conservatively, while the other half required emergency surgery. In 2021, we attempted endoscopic observation for a delayed perforation case in the descending colon and succeeded in endoscopic closure of the perforation site and conservative management. Thereafter, intensive endoscopic intervention became a major option for delayed perforation after colorectal ESD. In this report, we aim to elucidate the clinical course of delayed perforation and the safety and feasibility of intensive endoscopic interventions by reviewing all the records of colorectal ESD in 13 years. During the study period between 2011 and 2023, ESD was performed for 1,763 patients with 1,845 lesions. Among them, 32 delayed perforations occurred. CT was performed when suspected symptoms such as abdominal pain and fever were observed. The median period between ESD and CT was 22 hours. When extraluminal air was identified, delayed perforation was diagnosed and fasting and antibiotics were initiated. Patients were referred to the surgeon for an emergency surgery consultation. 7 patients required emergency surgery between 2011 and 2020. Of these patients, 5 underwent surgery within 6 hours after CT and 2 required surgery after conservative treatment. Beginning in 2021, when abdominal pain was localized, thus suggesting local peritonitis, we considered intensive endoscopic interventions comprising a small amount of carbon dioxide insulfation and sterile saline. When a perforation was identified, it was treated using simple clipping, over-the-scope clip, or PCA sheet according to the discretion of endoscopists. Endoscopy was performed for 5 of 6 patients between 2021 and 2023. Endoscopic intervention and successful conservative treatment were performed after identification of the perforation. In conclusion, emergency surgery was performed for a higher proportion of patients with perforations in the cecum and sigmoid colon. Intensive endoscopic intervention may prevent emergency surgery. An ongoing prospective trial with the aim of determining the safety and efficacy of intensive endoscopic intervention for delayed perforation after ESD is underway. This study focused on intensive endoscopic intervention for delayed perforation after ESD, but we also experienced some successful cases of intensive endoscopic intervention for delayed perforation after EMR or hot snare polpectomy. Thank you very much for listening.